For many, many years, if you knew the bug, you knew the drug. That has changed completely. And so now we have what you call multi-drug resistant organisms, MDROs. They're very prevalent in a hospital setting, more so in an ICU, intensive care unit, as well as in a long-term care facility.
So just as simply as people shake hands, these organisms can be sharing that resistance amongst each other. That's definitely something that we have to constantly stay on the ball with. We track via the CDC and the World Health Organization a lot of these things that are popping up.
We want to make sure that we educate people continuously over and over again, not only for the EVS staff, but also for the nurses and doctors. That's key. Because you can have a great product, a great program, but if you don't educate and train your staff appropriately, you will not get the results you should be getting.